Welcome to The Public's Health, the show that puts the public in the public's health. I'm Dr. Anthony Iton, the Alameda County Health Officer, and this show is a product of the Alameda County Public Health Department. Today, we're going to follow up from our show from last month. Such a rich subject, so much to say, so much, in fact, that we couldn't fit it all into one show. So we've asked our guests to stay here for a month and, in essence, continue where we left off from last month. Just to let you know who's here with us, we have Arnold Perkins, the Alameda County Public Health Director. We have David Mohammed, the Director of the Mentoring Center. We have Valerie Street, who is the Alameda County Public Health Department Violence Coordinator. We have Reverend Raymond Lankford, the Executive Director of Healthy Oakland. And we have Africa Williams, Community Building Coordinator for the City of Oakland. Welcome. Thank you all for coming back.
Thank you.
Thank you.
Thank you.
Arnold Perkins, Alameda County Public Health Director. Violence? Is this a public health problem?
Absolutely. Public health is about health. It's also about disease. It's about prevention. It's also about outbreaks. We've had an outbreak of violence within our community, whether it's the rate of murder that we've had, the rate of assaults. And a lot what goes on is because people are not feeling at ease. And so when you feel at ease, unsafe, hopeless, you tend to strike out. And so we look at that as a health issue. So we have devoted a lot of time. We have a Alameda County blueprint, a countywide blueprint for violence prevention. I like to call it community building. I think violence prevention is a misnomer. It's community building. If we build communities, then you don't have the type of violence that we witness now. When West Oakland was in its early years, 10, 15, 20 years ago, we didn't have the level of violence that we have now. So public health is about building communities, about taking the dis-ease out, which causes disease, and creating opportunities for people to feel more at ease within their community, therefore being more creative, feeling more a part of what's going on around them. Now people feel isolated. People feel hopeless. They don't feel a part of it. So we want to work with them to feel healthy again. So that's why public health plays a role. Okay.
A lot of people think of violence and violence prevention and they think cops. Contrast for us, if you will, the perspective of law enforcement and then the need for law enforcement's involvement versus or complemented by the involvement of public health, probation, social services, and other disciplines that have important perspectives to bring to the table. How do those things come together?
I think that law enforcement plays a really important role. When things are out of hand, you want to bring them back in hand, and they play their role. When people don't feel safe, they want to look to law enforcement. But I think the basic issue is, what do I need to do within my community to feel safe? Because once I begin feeling safe, then I don't need law enforcement there because I police myself. And now we have, there's a word I love, anomie, which means normlessness. We have normlessness within our community. And the question for us is, how do we take control within our community? How do we not feel hostage within our community? How do we feel a sense of hope within our community? And that's the role that we play in public health, is to encourage people to take hold in their community, to reach out to your neighbor next door, because it's those folk who live in the West Oakland community that will change things, not law enforcement, not public health. But I think those two entities play a vital role in assisting the community in getting on their feet. And once the community is on their feet, they take care of their health. But the last thing I want to say is, our young people are lost because we, as the older generation, we were lost, and they simply followed us. And now, how do we find ourselves to then assist our young people to find themselves? And I think some of the other panelists have the answers to how the community finds itself, how our young people find themselves.
Interesting, very interesting. David Mohammed, lay for us some of the environmental context. Violence doesn't occur in a vacuum. What are some of the forces and the influences that create in communities a greater likelihood of violence?
Well, many of our young people who are unfortunately committing acts of violence are products of their environment. When you grow up in a destructive, devastated environment, you're often going to display destructive behavior. So when you grow up in many inner cities around the country, particularly West Oakland, is an environment of blight, poverty, high unemployment, low quality schools, substandard schools, and you have a liquor store on nearly every corner. You have illegal drugs readily available. You have guns easily accessible. When this is your environment, destructive behavior is going to be the outcome. And so on top of that, you have years of policy. You know, guns kill people, people kill people, but policy kills people. And so you have years of policy of redlining to now allow economic investment into a community. You have zoning laws that allow for the oversaturation of liquor stores. You have the lack of health clinics. You have the disinvestment in schools. You have literally the destruction of a community. And over periods of decades, this has caused an environment that really produces destructive behavior. And so because of that, it's not going to take a program or a campaign or a strategy, because when you get a 15, 16, 17-year-old exhibiting negative and violent behavior, it was years of things that went into that behavior. And it's not going to take an overnight program or putting a few more cops on the street a few extra hours to change that behavior.
Why isn't this about individual responsibility? Why can't these people just pull themselves up by their bootstraps and live the American dream?
Well, to the young people I serve, I tell them it's all their fault. When I talk to system makers and policy makers, I say it's all your fault. In one sense, it is personal responsibility. I believe that self-improvement is the basis for community development. But I also know that systems influence behavior, environment create behavior. And the young people did not create their environment, they're victims of their environment. They did not create the systems of destruction and the systems of failure that are failing our young people. And so we have to attack personal behavior, but we also have to make the systems responsible. If the systems were responsible and the environment was changed, these young, resilient, wonderful young people would be different.
Valerie, tell me a little bit about your perspective on the environment, the social, the physical environment that you see in West Oakland when you're challenged with coming up with strategies to help build healthier communities, as Arnold Perkins says.
Well, West Oakland has a disproportionate number of abandoned buildings, liquor stores, rundown houses, junkyards next to rundown houses. You can just see from the master planning that has gone in West Oakland that there's been no real plan at all. We have a freeway that divides the community. And so when you have junkyards and rusting tubs and just general blight and no sense to what a community is supposed to be, no walkways, no pathways, few to no parks, people don't have a sense of being connected to their environment. They're just running to survive. So one of the solutions is to really look at how do we change the master planning for West Oakland to build more community spaces, more places where people can come together in a healthy way, for walking clubs, for learning how to share recipes and learn how to cook in new ways. We don't have many gathering places for people in healthy ways in West Oakland to meet, to be able to do these things. So we're working on strategies with residents to figure out, what does a new West Oakland look like? If we could just draw a new blueprint for the whole community, would that mean getting rid of the freeway? Would it mean getting rid of all these junkyards? Would it mean getting rid of all these rusting cars that are everywhere in abandoned buildings? And that's what it takes. The city, government, and the county have to be partners because they drive the policy that Brother Muhammad was talking about. Government does way too much to people and not with people. And that's where the community building comes in, where we work with residents to really challenge government, as well as we sitting here who work for government need to challenge government to do better. You know, it's just unacceptable the way these policies, zoning issues, and master plans have come forth to purposefully divide and create these negative environments in these communities.
So hold government more accountable. Reverend Lankford, the African American community, and when we're talking about violence in West Oakland, we're talking about disproportionate violence amongst African Americans. The African American community is known also for its spirituality and its participation in church. Where's the black church in this?
That's a good question. Well, I can tell you the black church in Oakland has been at the table. Measure Y was passed predominantly because of the support of the African American church. Many black churches have clean and sober homes for men and women with drug and alcohol problems. Many of our faith institutions have charter schools and after-school programs, tutorial programs. So the black church is at the table, but in fairness, the black church is not being empowered financially to hire and to continue to do the work with the rest of the community because government is not supportive. And what I mean by that is that if the city of Oakland would look at the model that the county has put in place, such as the Public Health Department, Department of Social Services, and partner and work more collaboratively with the community, then we can address the problem. Case in point, the violence over the years when the pastors have come together to work with the Oakland Police Department, crimes have gone down in the hot spots. So the faith community is at the table. They will continue to be at the table, but it takes economics. And then there's also a misnomer. Many churches don't have the financial fortitude that people believe they have. So we have to be open and honest about this, but it's the faith community that is one of our historically long-lasting organizations in our community that can reach the residents, and they're doing that today.
Okay, we've heard a lot about liquor stores. Liquor stores seem to be one of those sort of electric forces in the community that draws people's attention. And we now have a clip that we're going to show that talks to Reverend Lankford, takes us around West Oakland, and lays out some of the environmental context in which all of this activity is occurring. And we hope to come back from that and talk about the realities on the street.
This portion of West Oakland is a neighborhood that is a high volume of liquor stores, prostitution, drug dealings, no grocery stores, maybe 2 clinics, and no health food centers. We have a total of 300 liquor stores citywide. Over 85% are concentrated in West Oakland and East Oakland. And I think what the community wants is that for West Oakland and East Oakland and other neighborhoods to be treated like Piedmont and Montclair, where there's not an overabundance of liquor stores. But in order to really, have some effective change, you really got to have community participation and support. A lot of community organizations have come together to address the problems and have begun to work with some liquor store owners that are cooperative. The liquor stores, they're an association, so they're organized. So they have a spokesperson. He has an MBA. When he comes with a business perspective, not too many people can argue against him, but by the same token, everybody has to take responsibility. 90% of the sales, we're told, from liquor stores are due to the sale of liquor. The groceries are a facade because they have pictures of fruits and vegetables. There are no fruits and vegetables being sold out of the store. It needs to be brought to the awareness of the community that the liquor problems are also a health problem for people. When you add liquor and the high sodium foods, et cetera, that's a bad recipe for someone's life. Some liquor stores have undergone a lot of improvements and changes on the outside of the facility. So they have more lighting, more glass space, and they have a lot of other products there too. That's pretty good. Oakland is going through a big transformation now.
And we're back. Solutions. We've got an illustrious panel here, people with a lot of experience in working with community, working constructively towards solutions. Now we're going to hear about what they think we need to be doing right now and how you can get involved. Africa Williams, tell us about what you think the solutions are, given what we've seen on the streets. We know about the liquor stores. We know that there is an enormous amount of a burden, a challenge out there, but we also know that there are assets in these communities that we can build upon. What do you tell people about moving forward, taking this problem on?
Absolutely. Number one is getting involved in your organization, in your community. Attitudinal healing is one of, I guess, the greatest things you can do for yourself, and it helps to change and heal within. The next thing is getting involved in your neighborhood, looking outside, like Dr. Perkins said, looking to your neighbors, seeing what things in your community need fixing up, like your local park or your street or someone's next door neighbor's home. Also, the last thing is get involved in your neighborhood crime prevention council. There you can start to learn about the different agencies that serve in your community and learn about how you can get involved in working with, Pastor Lankford, and how you can work with other groups in the communities. A lot of information there.
And we've heard about policies from David Mohammed. You mentioned a little bit about guns, but do you want to go any deeper into guns, or do you feel that that's just sort of one of a number of policies that need to be addressed?
Well, there's a lot of policies that need to be addressed. Certainly guns is one of them. There's too much easy access to guns, particularly in the Bay Area. The liquor stores. Oakland has on the books one of the best statewide ordinance to deal with the oversaturation of liquor stores, but it's complaint driven. So we need people in the neighborhoods to talk about these liquor stores, which are depots of the culture of death. You can get the worst alcohol, the 211, which is the state penal code for armed robbery. You can get the cigars, where you take out the tobacco and put the marijuana and make the blunt. You can get the T-shirt with the most horrendous messages on them. So we need to do something about that. And then right outside, often you can get your illegal drugs, or sometimes inside. Another couple of quick things. One of the problems with the systems, which have good, well-written plans, juvenile justice, foster care, education, is often the people working there aren't sincere about the community. And unions have made it impossible to remove some of those people. We've seen that recently in Oakland with the police union saying we don't want police or fighting the police to their time. That's very true in juvenile justice and foster care and with teachers, that the unions, and I'm a pro-union, but unions often get in the place of getting good quality people involved in the work.
Do we need to bring the unions to the table?
By all means, we need to bring the unions to the table, because in every sector I'm working with, education, law enforcement, juvenile justice, and social services, the unions are a big problem in getting good quality people. The people who work for government on this panel are the exception. They're good, sincere people, unfortunately, than the rule. And so we need to work on those policies as well.
Let me pin you down here a little bit. Is it that the unions are not interested in doing this work, or is it that they haven't been involved in the process and don't quite see the significance of some of the changes that need to be made to government institutions and policies?
I hope that they're not I hope that it's not the case that they're not interested. I hope that they need to be informed, and they have such a hard line on we can't fire anybody, we can't retrain anybody, we're going to get involved in how many training hours they do. And see, sometimes you have great, well-rounded system. I'll make one example. Measure Y called for investment in programs in the community, which is great, but we need to look at what's the quality of those programs. So government, city, and county need to raise the capacity of community-based organizations and faith-based organizations. But Measure Y said we're going to have problem-solving officers, which is a great idea. And I was floored that they asked me to come do a training. Now, the Mentoring Center, we do an 18-hour training. They said, come do 45 minutes. I brought in 14 new problem-solving officers who I don't know them personally, but just when I looked at who they were, they looked completely disassociated from the community. They did not in any way represent the communities they're going to then go into and be the problem-solving officer. It's those type of problems where you can say in television, we're going to have 40 problem-solving officers, or we're going to have a brand new juvenile justice center with all these services. Then you get to who's doing it, and it becomes a horrible problem. And then it says, well, it didn't work, so we just need to lock everybody up anyway. And which is not true, because if you got good quality structures with good quality people, it would work.
Well, Valerie Street, talk a little bit about some of the institutions in West Oakland that are doing good work. I know that McClymonds High School has very good programs for youth. Dr. Barbara Staggers, who's working with McClymonds, and also at Castlemont High School, and Youth Uprising. These are programs that engage youth in positive, constructive activities. And it seems, and along the lines of what David Muhammad was saying, that if you don't make sure that you have quality programs and that you have enough investment in these quality programs, then people are prone after a short period of time to say, it didn't work, let's lock them up. So talk a little bit about the programs that you know that are on the ground working in West Oakland, and why we need to support those programs.
We have several excellent programs. One sitting to the right of me, Healthy Oakland, which is working day and night to really bring young people and community together in a dialogue and to learn from one another. We have the YMCA, which is also located there, where young people can come and learn new skills, computer, sports, and be mentored to some extent. We do have McClymonds High School, and we have the youth ambassadors there, where they're learning new skills and leadership and how to take responsibility in their community. So we have a number of programs, but I want to emphasize two things. Number one, the need for more mentors. If I were to make a call to the public today, I would beg each and every adult to become a mentor to a young person somewhere. Because what the studies show is when young people are connected to a positive adult person, they make a change in themselves. So you can make a direct change in somebody's life today by just being a mentor. That would be the number one thing on my list. Number two, I would ask that every church in West Oakland, no matter the denomination, to make a commitment today to not only sponsor mentorship programs, but to begin having a place where young people can spiritually heal. Because a lot of the dis-ease that Arnold Perkins talked about is not having a sense of self and spirit. We're dying from the inside. And until we get a sense of hope and a reason to want to live and be able to instill that in our youth and children, it's hard to restore community. So between mentorship and having the churches really step up and really push the spiritual development of young people and families, that you have a reason to live and you have a purpose for being here, you will see a change, because change starts from the inside and manifests itself outside.
Thank you. For those of us that are sort of quantifiably oriented, if that's a word.
Bean counters?
For those bean counters, the people who like data, there are good programs on the ground in West Oakland and East Oakland, throughout Alameda County, and the question may just be about scale. They don't have the resources to bring their good operations up to the scale that's necessary to create the kinds of environments and conditions in communities that we need. Reverend Lankford, if this is your challenge now, where would you rate sort of where we are? Are we a 3 out of 10 in terms of what we need? Are we a 9 out of 10? How much more investment do we need to make to get to where you think we need to be to have sustainable change in these communities?
Well, the late Lou Rawls said a mine is a terrible thing to waste, and there should not be a dollar calculation on abilities for our young people and our families. And I think the problem is that we limit the financial investment in poor communities such as West Oakland. You can look at Piedmont, you can look at Montclair, look at Berkeley and other cities that have similar young peoples with similar problems, but it's not as exorbitant. And one reason is because there's an investment. One is that doors need to be open. The Healthy Oakland Center, our doors are open generally 7 days a week, but that's not enough. You have to have people there, and people can volunteer, and that's great and it's wonderful, but some people, they do have to be properly compensated. And so there has to be true investment in our community. For example, it takes $5,000 a month to raise a kid in foster care, which is about $60,000 a year. It takes about $50,000 a year to raise a man or a woman in prison. I guarantee you, if we invested that type of money in the community with families for jobs, affordable housing, and other supportive services that they need, we wouldn't have the violence, we wouldn't have the murders, we wouldn't have the crimes, we wouldn't have the high school dropouts. And so it takes a proper investment. When I came up in Oakland, I grew up in a single parent home. We had after school programs. My father wasn't there, but I had the community that supported my mom, encouraged me to go to school and participate in athletics. And I made it, and there are thousands of others who've made it too, even under worse conditions than I have. But the support and the services were there, the investment was in the community, and we need to be honest and properly investing in poor communities where there's need. Also, nonprofit organizations and churches, they need the technical assistance support. It's not always the money as much as it's the support to enable the community to do the job and do a more effective job. So if I were a bean counter, I would invest in communities such as West Oakland and East Oakland where there is a dire need.
There's the challenge for us. Arnold Perkins, take us home. 30 seconds. Tell us what you've seen, how things have changed, and what your hope is for moving this work along.
I start off with my hope first, and let me stick with that. I think that, as Valerie said, our young people are dead inside. If I'm dead inside, I could kill you. There's no problem whatsoever because I'm already dead. And so we have to invest our young people not to be dead. We can always find money to lock someone up. If it's $60,000 for a foster kid, 3 times 60 is $180,000. And so if we were to have $180,000, we could do a tremendous amount. And so we have to reverse our investment.
And that's all we have for time today. I'd like to thank our guests, an extremely talented, thoughtful, and serious panel. We thank you for tuning into the Public's Health. Stay seated, please.